When it comes to pelvic floor dysfunction, the role of your hips on the health of the pelvic floor is so undermined, and this video is to show you why we need to not ignore the hips and pelvic floor dysfunction. So stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. Regardless of your gender, your hips exist, your pelvis exists, and if you have pelvic floor dysfunction, those areas need to be addressed. So your hips are where your legs are connected to the pelvis, and your lower back is another area that is connected to the pelvis. Therefore, the health of those areas, the alignment and the performance of those areas on the pelvis and the muscles that line on the inside, the pelvic floor muscles, are going to be they're going to have to be addressed, which they're hardly ever being done. When it comes to pelvic floor, we just go in, and most of the times we think of internal manual examination and tissue work, when in reality all the other things we're not really addressing properly. And that's the reason why I want to show you a very basic hip mobility exercise to address your pelvic floor dysfunction. Either it's a weakness, either it's a stress or super contracted, non-relaxing pelvic floor dysfunction, or whatever your story may be. If it's an incontinence, if it's a prolapse, whatever the case may be, this has to be done. So what you're going to do is you're going to sit on your seat bone. Seat bone is the bone right under your butt. So you're going to sit, I'm going to show you the side view. So you're going to sit upright. Your spine is neutral. That means you're not collapsed and you're not arching your chest or sticking your chest out. You have a neutral spine. I have another channel. We're going to pull a video from that shows what neutral spine is even all about. So then you're sitting with your feet right under your, or along the same line as the middle of your knees and to the middle of your groin. You're sitting upright, neutral spine. And now I'm going to turn around so you can see what that looks like so. And what you're going to do is as if your legs are fused to your body, so your legs are not going to go before your body starts rotating. Your body says, let's go, and the legs are attached to it. Think in those terms. And we're going to go this way, one way, like so. So the bottom and the top are parallel to each other, and then we're going to rotate back. Now, if I'm rotating, I need to think about this area up. My barrel is engaged. If you don't know what that is, we're going to put another video here at the end of this video that talks about biological breathing, which is so important, especially if you have pelvic floor dysfunction. So your barrel is engaged all the way to the connection of your femur, your thigh bone, to your pelvis, and you're gonna lift together and proceed to go to the other side. If you can't reach the bottom and you're collapsing, or this is all crawled up, it's okay. What is not okay is if, let's say, you're this way and the leg goes up to drag me and then follow the other one. That's a dysfunctional movement. That's how the problem started. So we need to really pay attention to how we're moving, because imagine if every breath you take is a reinforcement of a strong pelvic floor, then improper breathing, with every improper breathing breath, you're actually feeding the dysfunction more. Same is true with functional versus dysfunctional movement. If you're moving your body around from point A to B dysfunctionally, It doesn't matter how many sessions of internal manual work you've had to address your pelvic floor. You have the problem and you're feeding the problem. You're not going to solve the problem. So if you have any questions, please make sure you use one of the methods of contact in the description box. And if you need to be seen to see where you stand, where your dysfunction is, make sure you contact the office. I'll be more than happy to take a look at what your story is. Thanks for watching. Take care.